This is Dr. Karamanoukian from the Vein Treatment Center and veins.com. The topic of discussion today is going to be restless leg syndrome, also known as RLS. We have a lot of patients with venous insufficiency and concurrent restlessness of the legs, and sometimes restless leg syndrome, which is a syndrome that is a list of symptoms that patients with restlessness of the legs can have. So let's talk about restless leg syndrome and its relationship to iron metabolism, because there's an association between iron metabolism and restless leg syndrome. So part of a better understanding of restless leg syndrome and how to treat it is an understanding of what causes the condition. There are usually a number of potential causes for this condition that we will talk about in upcoming video clips. If you or someone in your family has restless leg syndrome, it may be helpful to talk to a physician who has an expertise in this area, so that you will be able to better understand and treat this condition. Research seems to indicate that one of the biggest and most common causes of restless leg syndrome is a deficiency in iron. There are a few ways that this can occur. One is simply getting too little iron in the diet, which can be easily reversed by eating iron-rich foods and also taking a multivitamin or supplement containing iron. For others, however, it may be that the body has a hard time processing and utilizing the iron. One thing we do know about the link between restless leg syndrome is that your brain requires iron. It uses the mineral to create dopamine, which in turn helps control brain activity. Dopamine affects the parts of the brain that control movement, and a deficiency can create movement disorders such as restlessness of the legs. Another reason why you may be deficient in iron, even if you are ingesting sufficient amounts of this mineral, is that there are many illnesses that affect the body's ability to metabolize and absorb iron, such as the different types of anemias and so on. Having one of these conditions can increase your chances of developing restless leg syndrome. So some conditions that have abnormalities in the absorption or metabolism of iron include rheumatoid arthritis, Parkinson's disease, the different types of anemias, kidney failure, and the pregnancy state. If you have one of these conditions, your body may not absorb or process iron the way it should. You may need to take supplements or other medications to help your body properly metabolize iron. Speaking with a physician about the link between your condition and restless leg syndrome may help you find a treatment that will help relieve these debilitating symptoms. Especially if you are pregnant, you should not take anything unless you talk to your obstetrician, and do not self-treat yourself. This is Dr. Karamanoukian, also from the Vein Treatment Center, recommending that you go to our website called myveinstore.com, where we have a product called Restless, or RLS, and this product contains different types of trace minerals, magnesium, iron, and other vitamins that have been shown, including coenzyme Q10, that have been shown to be helpful and deficient in patients with restless leg syndrome. Taking these supplements will help reduce your symptoms, the frequency of your symptoms, and the severity of your symptoms. I would also like to mention that there are some conditions such as venous insufficiency that are also associated with restless leg syndrome, and treating the venous insufficiency may help alleviate the symptoms associated with restless leg syndrome. Thank you very much, and visit our site veins.com and myveinstore.com. This is Dr. Karamanoukian. Thank you.